Welcome. My name is Martin ROOSLI. I'm Professor for Environmental Epidemiology at the Swiss Tropical and Public Health Institute. In the following, I will talk about the topic of children and noise. So, what is noise and what is sound? We have to differentiate between the two different topics. So, noise, that is unwanted sound. So basically, noise is defined as audible sound that causes disturbance, impairment, or health damage. So this already shows that if you talk about noise, there's a judgment into it. So would you consider this as noise? Or is it sound for you? For good emotions? What about this? Is this noise or is this sound? Does it depend on whether you are driving the car or whether somebody else is driving the car? And what's about this? Is all type of music sound to you, or do you perceive some of noise? Or does it depend on the timing when you hear it? What about bells? Is this noise or sound? It's quite a discussion and debate in Switzerland. Or having people outside and chatting, can this be annoying? Birds, natural sound, is this always sound? Or can even a river be disturbing to you, or the seaside? Or something very, very tiny, like a dropping tap, is this something that can disturb you? So you see, it's not so easy what is sound, what is noise. In principle, sound is measured as the variation in the pressure of the air, and it's measured in dB, so decibels. So this means that the increase of 3 decibels corresponds to a doubling of the sound pressure. And what is also important to know is that human hearing is frequency depending. You have the best hearing capability at frequencies around the human voice, and we hear less well low frequency and less well very high frequency. So if you measure noise for judgment, you usually do a frequency weighting, which is expressed as dBA. There are also different weighting possibilities, but the A refers to the human hearing capacity. And then another important term is LDEN. LDEN stands for day, evening, night, and this is an average sound pressure values where a penalty of 5 dB is added for the evening hours and a penalty of 10 dB added for the night hours. And just that you get a little bit of feeling about noise level. So typically speech level is 65 dB, high traffic noise is around 70, 80 dB, and if it's more than 85 dB, it can be a problem for the hearing capacity in the long term, and you see there's a lot of noise above that level if you are very close to these sources. So basically, noise is acting as a stressor. So the body is prepared even to fight or flight. So the blood pressure is adapted, pulse rate is adapted, glucose is emitted, that you have energy for this fight and flight. And depending on how successful you are, the stress ends immediately, or it can take longer and longer. It can get into chronicity, and this is a kind of problem. Very interesting, the German expression for noise is called Lärm and comes from the Italian word alarm. So this means take up the arms, the weapons. So I think this is a very, very good description of what noise is actually doing. It's also interesting to know and to realize that basically the ear is never sleeping. If you sleep, the eyes don't act anymore. They don't get visual impressions anymore. But the ear, even during sleep, is always processing what is going on. And if something is strange, if you hear something which is uncommon, you will wake up and react. And this is very good from an evolutionary point of view. This is important that you could react if something has happened, if a wild animal was coming to your cave or whatsoever. This was a very important reaction. But of course, this is not very useful anymore if you are sleeping close to a major road and your ear is processing the whole night information, which is not really relevant to you. You may get used to some extent to that, but still the ear is processing. You can measure that. The brain waves are active if the noise is large enough. You may not remember the next morning because you have slept and you were aware that this is a common sound, but it still is happening. So basically, we can differentiate between two different effects from noise. So the direct effect, this is on the one hand can be a damage to the hearing organ. It can create sleep disorders. And the indirect effect, which is more a psychological reaction to anger and annoyance. And both of them, they indicate the stress into your body. So the autonomic nervous system is reacting. So the pulse rate is changing, the heart rate is changing, and the endocrine system is reacting. So you emit stress hormones. And this results in an increase of risk factors for cardiometabolic disease and may create many different disorders like cognitive effects, mood, depression, distress reaction, cardiovascular disease, metabolisms, and maybe also others like immune system and etc. But there's not that much research so far on this. A very important document if you deal with noise are the WHO noise guidelines, which have been published in 2018. They have proposed the following guidelines here on the right side for night and for LVN. And if you look into that, they are quite low and it's very difficult to achieve them. So basically this means that quite a substantial part of the global population is exposed to noise level which is known to be bad for health. So let's specifically talk about noise and children. So one type of research that has been done, and several studies have been done on that. I just show one of the oldest, but still one of the most relevant one that has been done around airports in the Netherlands, Spain, and Great Britain. And what they could see in these 2,844 children aged 9 to 10 years was the higher the noise exposure from aircraft at the school, the lower was the reading set score, so the reading capability. So this has been shown also in other study, and the evidence rating of the WHO was for aircraft noise that there's a moderate evidence that this is a causal effect. For road traffic, the data is very less clear, and the rating was considered, the evidence rating was very low. So how could this happen? There are different paths that you can think about. So there could be a direct path from transportation noise. As I said, it could affect the sleep. It could interact with noise sensitivity, with annoyance, or with health-related quality of life. So here at the right side, you see some notes how this can happen. So the stress hormones can result in less learning processes. Most of you may know, have experienced that if you are very distressed, it's very difficult to remembering and to learn. So that can be a negative effect. It can also be that children perceive lack of control, so they get really passive and they don't really interact with the teacher. Maybe they just start to disregard any acoustical signals because it's so annoying, so they don't even listen to the teacher. So this is also then a problem for learning. Or they cannot understand the teacher, and then basically they cannot learn. maybe it's very basic. If you have overflights of aircraft and it's very loud, so then each time the teacher has to interrupt the teaching, so you have a loss of efficiency. And it can also be that all these effects concern the teacher, so he may be less motivated to teach the students. So all these are possible explanations that all together, or some of them, may contribute to the observed association between cognitive performance and noise. Another line of research looked into birth outcomes, basically like birth weight, low birth weight, small for gestational age, and preterm birth. There are not that many studies, and basically all of those studies couldn't establish an association. So it seems not that this type of effects are relevant in children. But if you look into the single studies, you would also realize that they are partly small studies, they have methodological issues. So I don't think that we can make any firm conclusion at that stage. This certainly needs a bit more investigation. Just recently, a very interesting study came out, a very large study around the Los Angeles International Airport. They have included more than 170,000 births with more than 15,000 preterm births. And what they could see is an association with ultrafine particle, UFB, with NO2, traffic-related air pollutants. But as you can see, also mothers who were exposed to more than 65 dB had a higher risk of a preterm birth. Blood pressure and cardiovascular effects are well established in adults. Still not everything and to each noise source, but in general, particularly ischemic heart disease related to road traffic noise, the evidence is quite high. So there has also been done studies in children looking into blood pressure, which you would expect that it is affected by noise. In the upper panel, you see studies that looked into the noise in the school and the kindergarten and whether this is related to blood pressure. And this is long-term blood pressure, not acute blood pressure. And in the lower part, it's about exposure at home. And in general, the associations are slightly positive, but they are not significant. So it's still unclear whether there's an association. And it's particularly not clear what does it mean in the long run if you think about life course of the children. It's quite plausible, and in adults, this has also been many times seen, that noise exposure has effects on metabolism, in particular diabetes and overweight. So this study here, it's from Norway, looking into 23,000 births, and they looked how the body weight of the children has developed in relation to the maternal exposure during pregnancy. And what you can see in this trajectory is a subtle effect that mothers who had been exposed to higher levels, their children have, after a few years of life, still higher exposure. So I think this is a very interesting example of the life course approach, so that an early exposure can later have some effects on an outcome. And then another topic for noise research in children are behavioral problems. So children may react aggressive if they are exposed chronically to noise. And this has been proven in several studies. Here is one study from Denmark, where you clearly can see an association between exposure to road traffic noise and different aspects of behavior. So A is the total difficulty score for strength and difficulties, and B is the hyperactivity in attention score. So to summarize, noise acts on the body via the sleep, via the autonomous nervous system, and the endocrine system that releases stress hormone. Noise research in children is still quite limited, So we have to be a bit careful in taking absence of evidence as evidence for absence of effects. For adults, it's more studies, and cardiovascular disease and diabetes have been repeatedly seen associated with noise exposure. And for children, most evidence, but still unclear, is whether there are effects on cognitive functions, behavior, and body weight. Research on birth outcomes and cardiovascular effects are inconsistent in children, but it's very important that its long-term consequences are better understood, because we would expect that even tiny effects which are not relevant in childhood may have a stronger effect later in life.